My name is Joseph Musisi.
Yes.
I am the operations manager here. I have been working with Lehigh, that's low housing income, for over 2 years now. This village opened in 2021, November of 2021. And since then, I have been here. We are working, most of our population, they are immigrants. Most of them, they are from Africa now, that is Angola, Congo, and then we have from Venezuela, Guatemala, and some other countries from Latin America. So for folks to qualify for housing here, Pastor John from Riverton Methodist Church, she is the referral. So she has a list of folks that need housing. So whenever I have an empty house here, I communicate to Pastor John, and then Pastor John, she will send those folks to me, and then I do the background check, I do all the intakes, and then I give them housing. And according to our codes of conduct, normally we keep people here for at least 90 days. That's our target. But sometimes it goes beyond that. Some can stay for over a year because they still have to work on their paperwork, get work authorization, start working. So we have been seeing a great improvement, and lots of people have moved into permanent housing. Lehigh is contributing, building a lot of buildings downtown in north and south. So yeah, we have a couple of folks that have moved into permanent housing, and from there they can stretch themselves. If they want to stay, they can stay. If they want to leave, they can leave. So actually here we don't really keep clients for so long because this is like a starting point, just to have a roof over their head and then move on into the process. Yeah, so that's what we do.
Thank you so much.
You're welcome.
Thank you.
Question.
Yes.
So do you guys charge them while they're here or when they get their paper? Maybe after 90 days, what's the incentive of people leaving? You know, some people might be a little bit comfortable.
Actually, we don't charge. We don't charge folks here. They stay here for free. We provide a lot of things. We can provide meals, almost of the basic needs they need. We provide them. And after that, once they get employed, because we have to track them, are you employed? We have to be notified. If a client gets employed, they have to notify us because we get them housing, which are low housing, whereby they can pay a portion of rent or they can only pay the bills until their income kicks that level we expect them to be.
And I can add that we have case managers like me and other people in different organizations. So we have resettlement case managers, we have job coaches, we have just regular case managers who are dealing with behavioral health. So if you come here and we identify you have so many things going on in you and we come up with a care plan, then we're able to help you with all those access points. As you've seen, there's showers, there's toilets, there's a food pantry, there's a place to start. At least you're not out there. And then we also want to take care of dignity and definitely their privacy so that they can recover and graduate. So there's a lot of case management.
Yeah, we also have a case manager on site.
Yes.
I have a question for him and for you too, Nora. My first question is like, if you qualify to this, how many are you supposed to be in your like a family? Maybe your mother with how many kids, or
Actually,
you have
the max I can let stay in this house is 3.
So
But
mother and
sometimes
2 kids,
a mother, if the
dad,
parents with 2 kids, I can let them stay. But we have to make sure that we work on them first to get out of this kind of environment.
My second question: how long did you stay? Like
90 days.
Actually, it depends, because if someone comes here when they are undocumented, it's sometimes hard to get housing for undocumented people, though we get them housing, but it's a little bit complicated. But once they start working on their status, So things becomes a little flexible for them.
Now, because you said that, I have that question. Do you help them with status change? Or
Actually,
do you
yes,
guide
we
them,
have
or-
a legal team.
Yeah, you
Yeah.
have a
that
legal team. Is the legal team paid, or it's like pro
they are
bono?
volunteers
Most
as
of the
well.
time it's pro
Pro
bono.
bono.
Yeah,
Pro
we also
bono,
have
yeah.
resettlement organizations like IRC, RRO, and Lutheran Community Services, which are just around here. We also have other people like NAP and WIRP in Seattle. So most of the time, when they are identified, then they are put to those case managers and referrals, and so they can get help and come back here. So this is actually home when they are trying to navigate those little pieces. Once they are pieced together, then there is a channel and a flow of events to where they graduate to being independent. And when they become independent, doesn't mean that they can't continue with case management. They still continue case management until they feel they can firmly make their decisions on their own. They can definitely, flex their wings.
My last question is to you, Nyawera, because you said you are a social worker.
Yeah.
So, like, how someone does, like, we have many houses here. How do you have to access a social worker, and do you have like a lot of workload, and how can I make sure my case is like a priority? Because when I come here, I just want to, maybe everyone comes here and want their case to be, because I had people saying like social worker, they had people find in America, because like you're all,
It takes
got,
time.
like priorities.
Yeah. Yeah, it takes time.
Do you prioritize on some cases, or you just pick from the
Definitely.
day they arrive?
Definitely, just like he said, if a family has a little baby, maybe someone is pregnant, maybe they have a lot of things going on, you want to get them through the system quickly so that they can settle down, because it's also a risk, We're trying to do the best that we can. So mostly when I have a caseload that entails a lot of difficult points of view, I try to bring in a lot of team towards, the help and follow up a lot. But what we tell our clients, it's be patient. The system is not only working for you. There's so many other people in the system. Please communicate, be consistent, because I could be helping you, but you communicate with me once a quarter. In that once a quarter, a lot of things have changed in between. So it's a constant communication, it's a constant follow-up. That's why you have a job coach, that's why you have a mental health case manager and medical case manager. That way, all that team, it's called an interdisciplinary team, they can all work together to help your case. That way you can move along the system quicker. But sometimes, as we know, the system takes a bit longer. So we want people to be patient.
Another question. So if I come here with our family, means
Yeah.
like I can stay here for long than someone who have 2 kids. Why don't I have a person and get kids and then my kids
What you have said,
It's true. Yeah, you will answer that because it happens.
once you've said it's true.
Yeah.
There is a time I had 780 people here.
Correct.
We had a lot of tents
Yeah, we
over
had a
there,
tent over there.
right?
Yeah, where I showed you the parking.
And I had to manage those people.
Yeah, and it was hot.
And a lot of people here, they saw that I was giving a priority to pregnant ladies, women with kids, and they said, okay, I'm going to get pregnant so that I can get a house. I'm going to get a baby so that I can get a house.
Which is the system.
Actually, anyway, I'm from Uganda. And we have a saying that amaziga gembwa tegayisa mbuzi malagala. Meaning, a dog, a goat cannot go into through the potato leaves because it will eat them. So the dog, if goes there, you think, oh, they will not hit me, they will hit you probably. So when those ladies thought like that, anyway, some of them benefited because we had just started a program of sending them into the hotels. They are there in the hotels. Some have graduated, went in other communities. So actually, that cannot be an excuse that let me get pregnant or get a baby so that I can be considered quickly. Sometimes it's first come, first serve. We cannot just skip for, because you are ABCD. You can be pregnant or you have kids and you are healthy. But I have someone who needs a surgery, who needs a better place, who needs a place that is warm, then I can look into that person. So, yeah, it varies. It depends. If you are lucky, you're lucky. If you are not, you have to wait.
Another question: what would you say is your main challenge here? I know there are so many challenges, but you know,
Main.
Well, the main challenge here, as you see, most of my folks they are not employed, right? And that means they have to depend on us on most of the things. So I normally have, I call it a community meeting with some neighbors here, people from the city of Taquila. I always advocate for my clients, especially I need the hygiene staff. And if I get those things, these people will be better. That's my challenge. The good thing is that my folks here, most of them, they cook for themselves. So I'm not worried about food. Compared to other places like this where they have to deliver food, cooked food. But here, most of my folks, they cook for themselves. They go down there in the food bank, they get food, they volunteer, they get food, and they help themselves. I'm not very much worried about that. But hygiene, that's first thing that I need here.
Yeah.
And then another quick question: have you guys started feeling the impact of like the Trump?
The changes in the system.
Yeah.
Actually, yes. But it has not hit here yet.
Okay.
Yet we are a target because of the church and having lots of
Refugees,
so we have been educating our folks in case they come. What do you have to say? What do you have to do? I have been educating my staff. If anyone comes here looking for anyone, we cannot let anyone access here.
Correct.
We don't just tell, oh,
Retro
this
is here.
person lives in this unit. No. We have to stop them immediately and we
Right.
send them back. This is a private property. Yeah, but
Thank you so for what you do. Really.
but they are in fear.
Yeah.
There is fear.
There is fear. But we try our best to make sure that we bring that hope to them. Yeah.
Wow.
Thank you so much.
Thank you.
You're welcome. And thank you for visiting.
Yeah.
We brought some sanitation stuff, and we are hoping that in summer we're going to do another clinic. I
Okay.
did bring the clinics to Jen
Oh, that's
for
good. Yeah.
hypertension and diabetes, so we hope to come back in a few months.
Oh, that's good. Once you,
Remind me your name again.
I'm Joseph Musisi.
Joseph.
Joseph is
Yeah.
Is
Person
there
in
still
charge.
like couples who live here still, like married people?
Mhm. And I have a good number of couples, at least like 7 or 8. Yeah.
Another question: how big is your room?
How big is the rooms? The tiny homes?
Yeah.
Yeah, those are 8 by 10.
Thanks for doing
Wow,
the good
thank you.
work.
All right, guys.
Yeah.
Thank you for visiting.
Yeah.
And see you again.
Mhm.
Next time you're gonna come a big